Still good morning. Good morning, Dr. McNeil. Right. Exactly. Okay, we're going to get started because we have a full group here at 8 o'clock. And I'm here at 8 o'clock. So welcome to the first Academy Master Educator Series. This year I'm organizing it with Jason Rosenstock. So you will note that I'm speaking today. He's speaking next month. And he will be talking about syllabi, right? The do's, the don'ts, how to make them good, pitfalls to avoid. We haven't quite decided the catchy title yet, but it's a little advertisement for next month. I will just remind you that these series in the Academy Master Educator are designed to have two different types of talks. One is sort of the how to teach talks, and the other sort of faculty development. So we often do things like negotiation or your CV or things like that. So we try to get a balance with those kinds of talks. And today what I wanted to talk about is sort of a playoff on what Marie Norman talked about a couple of weeks ago. Marie was here to keep me honest this morning. Is this what we're now beginning to understand about how to facilitate long-term learning and retention? Because I think that one of the things that has become clear is that what learners like and what works for short-term reward, meaning passing the exam at the end of a course, is not necessarily the best strategies for their long-term retention of material. So I'm going to play off a little bit on some of the science that Marie introduced a couple weeks ago and ask us as a group to brainstorm a little bit how we can take some of that science and use it, how we can apply it to the teaching venues that we're in, and then to think a little bit, ask you to generate some ideas, and then I'll share some of the ideas that I had, and then maybe a year from now we'll see what changes we've made in our curriculum. So you guys get to vote now. When you attend a lecture, what do you prefer? Complete PowerPoints, PowerPoints with bullets, or no PowerPoint slides and you just take notes and time? So we're going to vote. Complete PowerPoints.
Wait, is this what you prefer?
This is what you prefer.
For your learning?
Well, it's supposed to be what you prefer. I'm not quite sure what happened here. So the question I'm asking you to answer is, what do you prefer?
As a teacher or as a student?
As a student. As a student. Complete PowerPoints? You can put your hand up. That's what I prefer, right? That's what I prefer. PowerPoints with just the main bullets. Ugh. And then no PowerPoints. You just take slides. I got one. Brent's got his hand up back there. So the answer, and I have to say, this is a little challenging for me when I think about this, because a lot of what we are on the receiving end of is not part of a curriculum or a course that you're going to be tested on, right? It's sort of like a one-time lecture. And I actually do feel a little bit differently about that than something that I'm trying to commit, to memory. So the answer is, what's better for your learning is actually no PowerPoints at all. You just take notes. And we'll talk about why that's better for learning. That is clearly not what learners prefer. It's clearly not what learners prefer. Do you prefer to study? How do you prefer to study for an exam? Remember, those of you who are younger in the room who have been studying for boards, those of us who are grandfathered in for whom boards is a distant memory. Reading notes, highlighting and underlining. What do you prefer, coffee or tea? Sometimes the graphics, you have to stretch your imagination a little bit. Rereading notes, highlighting and underlining, memorizing tables, charts in the syllabus, foreshadowing for Jason here, making your own charts and outlines, or making up questions that you answer. So this is what do you do? If you were studying for boards now, what would you do? Reread notes, get your mix app or whatever, and read them and highlight them? How many of you do that? Okay. Memorize tables and charts in a syllabus that's been given to you. Okay. Make your own charts and outlines. Okay. Then make up questions that you answer. So Greg is making up his own questions. Okay. Which is better for your learning? And again, this is this piece about active learning, right? The more that we do and put into it, the better and learning, by learning, what I'm talking about here is long-term learning, retention of material, not cramming to take the test. So, now you're a teacher, okay? Do you want your cake or your pie? So, and I'm going to change this question to not what do you prefer, but in the curriculum that you are in charge of. Some of you are in charge of curriculum, some of you are not yet. But we all round on the wards. Some of us take morning report, do student teaching, we all have venues where you have learners for more than 1 hour at a time. So what do you implement? So weekly quizzes with a final, midterm and final only, questions about recent material only. So there's two sort of sets here that I've broken my thing. So first for your testing strategy, which is the better for learning? Or what do you do? Weekly quizzes, so questioning your learners on a weekly basis about what they've learned. Pardon?
What do we prefer if it's easier for us, or what do we prefer to do for the students?
I'm going to say, what are you doing?
Okay, what are we doing?
What are you doing?
Which is closer to the
Right. Well, exactly. Right. Exactly. Anybody doing weekly quizzes and stuff that they teach? Weekly quizzes with a final. Okay. Peter's doing that. Midterm and final only, or final only in our class. Okay. Okay. Next thing. If you were to, either on your quizzes or a final, would you question only about what you taught? Let's say you're on wards or rounding on your subspecialty consult service, and you have your learners, and you're going to give them questions twice a week to see what they've learned, Wednesday and Friday. On Wednesday, you're going to, Greg's like, yeah, really? No way. No. So, some people only round for a week at a time. I have to make that up. So would you, on Wednesday, you're absolutely going to ask them questions on Monday, Tuesday, and Wednesday, because that's all you taught them. On Friday, are you going to ask them questions from Wednesday to Friday, or are you going to ask them questions for the whole week? Who's going to ask them the new stuff? Who's going to ask them the whole week? I mean, I realize you're not doing this, but if you were to. Okay, and so the answer here is that the more you test, testing can be informal, it can just be asking, in courses that we run for the medical school, the more we test, the better. Weekly quizzes would be the ideal.
You can show us data for that.
Yes. And the other piece about this is that I'm trying to remember when you asked that question whether I included the data to that effect in there. I think I have it on some space, but I think I do have that data in here. And the second piece is about the cumulative learning, that you're infinitely better to ask questions about stuff that's new and that's old. And part of the reason for that is because you reactivate those memory tracks. And this is what Marie talked about. This is about retrieval practice, augmenting long-term memory. And I think one of the things we need to understand with our learners is we really, in order to function in the medical setting, you have to have some long-term memory. You have to have the scaffolding. You can't go back and you can't just look everything up every time you have a patient who walks into your office. So with that setting, I want to talk about some truths. Truth number one, to be useful, learning requires memory. And this is one of these things that for many of especially our medical students, they're just not buying right now because they just think they have their electronic devices and they can go look up everything they need to know. But you need have it, at least, not everything in your brain, but enough in your brain that you actually know what questions to ask and how to frame the question. And you can't go look up everything. If I have to look up what a systolic murmur means and how big a liver should be and have to go refresh how to examine for a spleen and what does it mean if I have a Babinski. I mean, we have blood patients who come in with lots of weird kind of stuff. If I have to look up all of that kind of stuff before I can even begin to think about how to put it together, I don't have the time or the bandwidth to manage the speed that we need to. So what we have learned needs to be there later when we need it. You need to be able to retrieve it. The second truth is we need to keep learning and remembering all through our lives, certainly in our careers in medicine. I am quite sure all of you, those of you who are my vintage, I grew up reading Harrison's, right? You guys are all now up to date, but I read Harrison. Bill said, yeah, Harrison. And I would be so depressed because I would open my Harrison's to a disease I didn't know anything about, and it would be highlighted in 3 different colors, meaning I had read it 3 different times. And that one disease that I remember that I don't know anything about is porphyria. I so tried to commit porphyria to memory, and I just can't. So I have accepted that my memory of porphyria is that I don't understand it, and I have to go look it up every time I see it. There are lots of other things I don't know, but that's the one I remember I don't know. So, and the third thing that I think that's really important for us to appreciate is that learning is an acquired skill, and the most effective strategies are often counterintuitive. And that feels a little silly to be talking about in the context of the level of learners that we all deal with, right? Because we deal with learners who have clearly been successful and have been able to learn. But I think that there are 2 things I want you to remember. The older we get, the farther you go up the chain of command, the pipeline, the more you have to learn and remember. And actually, when you get to practice, you really do have to remember it all at once. You can't just remember cardiology in your cardiology block, or neuroscience on your neuroscience block, right? And even if you think about how we manage, even on the wards, even though for us in medicine we have general wards or the ICUs or whatever, we still pull out our oncology patients and send them somewhere else. We pull out our cardiology patients and send them somewhere else. So we do a fair amount of blocked learning, and we have to keep learning. So some of this is also how we are going to learn for ourselves. It's interesting, when I talk to the medical students, they already know I'm old and a dinosaur, but I say, guys, when I was a resident, aside from walking barefoot uphill both ways in the snow 12 months a year, there was one CT scanner in the city. There was one CT scanner in the city, and it was at Presby. And if you were up at the VA, you had to really want that CT scan, and you had to go with the patient down to CT scan. We didn't know about HIV. We still did build lots for peptic ulcer disease because we didn't have H2 blockers or proton pump inhibitors, And by now, the house staff and even the young faculty are going, "You are a dinosaur," But this kind of learning goes on forever for us, and so we have to figure out how to figure that out. So how do we learn? Some of this is a review of what Marie went through, but I think it's important. The first concept is that learning is deeper and more durable, which is what we want, right? Deeper, durable learning, when it's effortless. Learning that's easy is like writing in the sand. It's here today and gone tomorrow. So I can cram for a test and I can pass that test, and 2 weeks later I won't know any information at all. Okay? We are poor judges of when we are learning well. The importance of that is what we like is not necessarily what's best for us. When the going is harder and slower, it doesn't feel as productive. You can get through a whole lot more material if you're just reading and underlining and highlighting and starring and drawing little arrows than if you're actually outlining something or making your own chart or answering questions, which are focused nuggets of information about a particular thing. we may be unaware, we are unaware that the gains from these strategies are often temporary. So again, I can pass that test, but when I need to sit down for my boards, or more importantly, I need to pull it out to manage a patient, it's hard to access. Rereading and mass practice of new knowledge are by far the preferred strategy of learners, but they're among the least productive. What our learners like is they love block learning. You know, our curriculum in medical school right now is all block learning. You're doing one sort of course at a time. So organ system blocks. You know, when, again, the dinosaur, when I graduated from you had your biochemistry course, and it was running at the same time as your histology course, and it was running at the same time as your anatomy course. And there was a lot of thought that went into moving to block learning strategies, that this would be easier to learn because you could be learning everything that you need to know in context together. But as I'm going to point out to you, that's probably not the best strategy, because it keeps you just in one little pocket of your brain. And that's this mass practice, single-minded, rapid-fire repetition of something and trying to memorize, like cramming for an exam. So this is, you know, if you think about our medical students, they start with anatomy, and all they do is anatomy. They're just in anatomy, and they love that course. It's well taught. They have one type of material to learn. They can focus on it. They get a test on it. And it's probably not the best strategy. Reading and mass practice gives rise to feelings of fluency that are taken as signs of mastery but have no durability. You know, this, for me, I know exactly what this means. This means when I'm sitting down to take a test and I see the question and I know it's at the top of page 275 in that damn chart that I can't remember, right? So that's a fluency. When I read things and I highlight them, I say, yeah, I got this. I know this. I've read this. Looky, I've underlined it. I understand it. But because I haven't used it, I don't have a durable memory of it. So retrieval practice is defined as recalling facts or concepts or events from memory. It is a far more effective learning strategy than rereading. This is flashcards. This is outlining information. It's filling in charts. So you think about how we do our syllabuses or what we do for our learners, especially our medical students. We give them syllabuses that have exactly what they want, what they need to know in it, and they go home and they memorize what's in it, and they actually don't fill it out. I got a lot of, get a fair amount of pushback in the physical diagnosis course, because unlike some of the courses we run in the medical school, there is a lovely textbook called DATES that is for physical diagnosis. And so when I look, my syllabus says things like, know the differences between dementia and delirium, know how to differentiate between an upper and a lower motor neuron. But I don't actually outline all that for them under the objectives. Because, oh, by the way, it's in the book, and you can go find it. And I get serious, and truth be told, some of the reason it's that way is not because I was so clever, because really it was in the book, and I didn't need to outline it. They did. So I was a little bit kind of like what Ankur was talking about, what's easier for the faculty. It's way easier for me, but it turns out that was a great learning strategy. So we're sticking to my guns on that one. The next bullet I want to point out is that testing is learning. A single, simple quiz after rereading a text or hearing a lecture produces better learning and remembering than rereading the notes or the text. This is that piece about going to do your mix-up if you're studying for boards, or for us in courses that we run, giving weekly quizzes, even low-stakes quizzes that are not designed to stress, but are just designed to have people check their memory can make a huge difference. And then bullet number 8 is this concept of spacing out practice and or interleaving the practice of 2 or more subjects. So that's that piece about, do I learn biochemistry and histology at the same time, or do I just take one course at the same time? the concept of interleaving, and this is actually, it's amazing if you Google image, what you find. Who would have thought you would Google image interleaving? A whole bunch of graphics come up, But what this is purporting to show here is that these are different, these things are different courses that are running all at the same time. And so I have a little bit of yellow, a little bit of blue, a little bit of red, a little bit of green. And then I come to the next week and I have a little bit of yellow, a little bit of blue, a little bit of red, as opposed to a block of yellow, a block of red, a block of blue. Okay?
That's how it's done in elementary school and junior high and senior high. They have
Yes, it is.
7 or 8 subjects every single day.
Yes, it is. And actually, it's really interesting. When my kids went through high school, they moved to a block schedule. There was clearly a push at some point. I don't know if you have followed when, but it was clearly a point when my kids were in high school. And they graduated from high school in like 2002, 2003. They were in block schedules. So they would have, instead of 8 courses, one each semester, one each period throughout the 2 years. Throughout the year, they would have 4 in the first semester and 4 in the second semester. And that was done because of the thought that it was easier to learn, right? That people could focus more and get more in depth into the material. So the concept of interleaving practice is 2 or more subjects. It's a little bit harder for them to learn because I have to shift my brain, right? Now I'm talking about algebra, and now I'm talking about Shakespeare, so I have to shift my brain. But that shifting, that retrieval, that going back, actually facilitates better cognition. And then this other concept is the spacing out of practice is a little bit of a different, supports the same idea, but a different concept, which is I'm better off to learn, instead of putting 30 minutes of study into one topic, I'm better off to put 10 minutes of study into one topic 3 times. Because I shut my brain off, and I have to wake my brain up and go back and retrieve all that information. That is clearly not how we all prefer to study. We think about our medical students studying for the boards. They don't do a little bit of this and a little bit of that. They will complete one course and then go back. Tweed, did you have a question?
So I think for medical students, we try to encourage horizontal reading. I think we should have the same concept about a topic rather than vertical reading. I think horizontal reading is actually more challenging for learners.
It is. It's much harder. But the payoff is that it's a more durable memory, right? And so the question is, this is like all of us doing a lecture, right? I can teach 1,000 things, but you're going to remember 3. It's easier for me to cram with vertical learning, right? I can feel really good at the end of that 2 weeks that I know all that information, but it's not as durable.
How do we teach learners that horizontal reading and they struggle with?
Well, and I think actually, Tweed, that's the whole point of what this is. How can we as teachers put some of that, how can we encourage our learners to have that horizontal, whether you call it reading or whether we call it retrieval, but the horizontal piece is, I think, the important piece. So, number 9, trying to solve a problem before being taught the solution leads to better learning even when errors are made in the attempt. And I have to say, this is probably the one that I was the most surprised about when I was learning this information, because it seemed to me sort of silly to give people a question when they didn't know anything about it. And you have to, you can't, these are better for conceptual things than fact. You're not going to give people French vocabulary words when they don't know any French and say, what do these words mean, right? You're not going to do that. But in fact, asking people to do problems before you give them the answers, and I'm going to show you the theory of that in a minute, is actually a very effective learning strategy. And it's a little frustrating for learners because they're like, well, why would I know this? I don't know this yet, But it can be very important. And finally, this concept of when you're adept at extracting the underlying principles and rules that differentiate problems, you're more successful in problem solving in unfamiliar situations. right? That's that piece a little bit about the interleaving. I mean, if you think about it, we run a cardiology block and we run a pulmonary block. We have patients on the cardiology service, but almost all cardiology problems. Every now and then, a lung problem sneaks onto the cardiology service for shortness of breath. But in reality, for our medical students, when they're in their cardiology block, the questions on their exam are all going to be cardiology questions. So there's a whole set of information they don't even try to retrieve. And this is some of the effort. We now have a week of integration now for exactly that purpose. Maybe I'll ask Jason to talk about that a little bit more. But the idea is in the real world, when an undifferentiated patient shows up to you, you don't know whether you're not in the cardiology block or the pulmonary block or the infectious disease block, right? You have to go back and forth. God forbid some woman with belly pain who has a gynae problem shows up in our ER, right? That's just not where you're supposed to come in Pittsburgh if you have a gynae problem, right? You should go to McGee. And it confuses people, because we have preconceptions. Okay, so the question for us this morning is, how can we use this knowledge in our teaching? There are two strategies for your teaching. One is a major transformation to your course. There's some examples here. You can flip your course so that you don't do any lectures, you just do small group problem solving. You can put your course online, right? These are major changes. These are sudden and dramatic transformations. Getting buy-in is sometimes hard, and it's really hard work. So when we're trying to go to faculty and ask them, thinking about you guys making these kind of major transformations to a course, that can be really hard. On the other hand, there's this concept of what I want to introduce as small teachings, and point to a book called Small Teaching, and I give the references at the end, which talks about strategies to just change up a little bit how you teach to highlight these principles. So the idea of small teachings, which is what I want to work with today, is that learning principles are readily translatable into teaching behaviors. And that with small changes, we can make a significant impact on the durability of our learners' learning. And that this approach is about positive change through small but powerful modifications in course design and teaching, things that are pretty easy for us to do and don't feel so overwhelming as being told to put your entire class online or something like that. So, retrieval practice, retrieval learning. That's that idea of asking people to remember what you just taught them. So we're going to brainstorm for a couple minutes. We have 3 different groups. How can we do this for medical students? How can we augment retrieval learning? This is the audience participation part.
Quizzing.
Quizzing, right? Thank you for paying attention. Sorry. Right, quizzing, right? You could just give a weekly quiz. You could give a weekly quiz. What else? Any other ideas?
Doing like a talk on something or a didactic or something, like giving a skeleton, but having them fill in as you talk or as you discuss instead of just giving them a handout.
Right. So that's more the effortful piece of making you have to pay attention and learn and make those connections. But one of the issues about PowerPoints, and I struggle with this, it's easier for me, the more words I have on the slide, the easier it is for me to give the lecture, right? The less words I have on the slide, I'm more likely to get ahead of myself or forget to say something key. But in reality, making our learners have PowerPoints with just big bullets in front of them, where they actually have to listen, decide what's important, and write it down, is a very powerful learning strategy. Very powerful learning strategy. How about resonance? How can we do this with resonance?
It's actually a very good question. I was thinking about it last week, and that's why we started. See, last month I taught, my residents how to manage flash pulmonary edema. I mean, we talked about 30 minutes. And the next week, there was a case of flash pulmonary edema, and they were doing exactly the opposite of what I taught them.
Don't you just hate that? I just hate when that happens.
Luckily, I got there in time because they got a condition C and then stopped for the damage. So, I mean, I was totally disappointed, and I was thinking of ways what we can do to make sure they learn and retain stuff. So one of the things we can do is, at the end of every month, we should probably have a little quiz, like a written quiz, that incorporates precisely what was taught. As kind of like, didactic teaching, or incident, if I talked on the rounds about how to manage, say, AKI, maybe I should incorporate questions from that. So at the end of the month, the residents and students, everybody will know that they'll be quizzed on what was discussed during the rotation. I think that will be a great strategy, and also kind of a incentive for them to remember and retain what was taught during the month.
So Amar is highlighting the point about going back and re-ask. That wouldn't have helped your flash pulmonary edema, right? Because it wouldn't have been the end of the month before you asked those questions. So one of the question is actually coming back at some intervals. And there's a couple different ways you're going to do it. I'm going to show you in a minute. But, one can just be formal questions. One is people spend a lot of time and energy. You could write your own questions. People spend a lot of time and energy looking for mix-up questions that Greg's making a frowny face at me. He doesn't have his hand up, but it's a frowny face.
I think one of the things that's really challenging, I think it's easy for medical students to give quizzes about things that are factual, like what's in the middle cranial fossa, if that's even a thing.
Because our durable learning has long let go of that.
But there's a lot of things that we do in clinical medicine that are nuanced. And I think one of the things that happens is people undermine other people's learning. And I'm fairly confident that somebody else has taught them an alternate way of managing flash pulmonary edema, who the learner equally recognizes as an expert. And one of the things that we just don't do really at all is sort of a peer review process where we look at the care and say, yeah, that totally makes sense, or, that's really not the right way to do that.
Would anyone like to respond?
But that's one case out of hundreds.
Well, it's a lack of teaching critical thinking skills. So it's one thing to teach people, here's how you do something step by step, but if you don't dig deeper and have them generate the reasons for things, you're not looking, well, why do I do that? What's the rationale behind that? And they never develop those critical thinking skills. I think one of the most important things is asking residents to do teaching. You have to regurgitate. Putting a talk together is the best way to learn.
Right.
Writing a paper is the best way to learn something.
So I'm gonna agree tremendously with that last point, and I find even for myself, my best learning is when I teach something. I mean, it depends a little bit on the heat of battle. Sometimes I volunteer to teach things I don't know much about because I think, well, I'll learn. Sometimes I say that one's canned, so I'll do that one. But teaching is a spectacular way of doing this durability. With Greg, what I would say to you is I think that there's no way to work around the fact that medicine is both a science and an art. I think there are some things that are more objective. I think the approach to AKI to me feels like something I have an algorithm for, and almost everybody's algorithm is the same algorithm. The criteria for diagnosing SIDH, pretty much everybody would agree are the same things. The sepsis criteria. There are some things that are just in the literature and evidence base, and all of us have to teach those. Hopefully, in that, I think that some of us, all of us, things change, and I don't know it. I'm always irritated when that happens. I still remember one day being on the wards, and all of a sudden rifaximin was being given for hepatic encephalopathy, and I'm like, so tell me about that. Am I right? Why are we getting this medicine? Kind of thing. This is Bill's like, what? What is this So there are things that we don't keep up with that just happen before we know it. So my answer, that's a little bit of a babbling answer to that question, but I think there's some things that are more absolute and some things that are conceptual. I think the better understanding you have of basic principles and factual, the scaffolding of what is true, the easier it is to do clinical reasoning. The way I reason clinically may be a little bit different than the way somebody else does. And for example, I know you and I disagree totally on Pulse's paradoxes. Whether that's an important finding for Tamponade.
I just don't know how to do it.
I know, and I told you like 4 times how to do it. I'm not getting into your durable learning, you know.
I taught you that.
Yeah.
I don't disagree
Right.
with the importance.
Right.
I just can't do it.
Right. So Dr. Follensby will be having a session after class today.
It's my portfolio.
But I mean, I think there are different faculty who are going to emphasize different things, and we don't really do a check on it. I mean, that's, you know, but I do think what we teach, we can ask them to come back and tell us. And I'm going to give you some examples that are a little bit easier than sort of writing your own questions and do them at the end. For faculty development, grand rounds, we go to conferences. Sometimes it's not that hard, guys. Sometimes it's the quicker questions at the end of a session, right? I mean, that's this point about it doesn't have to be high stakes testing. The goal is not the goal is to in this material that I'm presenting today is to augment learning, not to assess learning, right? Testing to see if you remember it is all about evaluation. Testing to augment learning is to check understanding and to augment retrieval. Okay?
That cognition strategy takes to reflect on what happened, and that's considered part of retrieval.
So that's foreshadowing. Hold that thought. So there are a couple of tips that are easy. And again, you know, you just Google opening questions and look what comes up. So one of the things is to start a lecture with a question about, and you will see Bob Arnold do this all the time. Tell me 2 things you learned yesterday. Tell me 2 things you learned yesterday. So you don't actually even have to write the questions. You just ask them to tell you. And you make them, and you can either do it orally if you have a small group, or actually the preferred strategy is probably writing. Because if you ask people to write, that does 2 things for you. Everybody actually plays. And actually there's a lot of data that writing actually augments learning. So it's better, that's why having those PowerPoints that aren't complete actually helps you learn. You know, all that sort of stupid stuff that if you give handouts with blanks in it, which feels like 5th grade, but is actually a really good learning strategy, because 1, I have to be paying attention and connecting the dots, and 2, I actually write it down. There's actually data that writing is better than typing, you know? So everybody who sits there with their laptops taking notes would be better off to be taking handwritten notes, which, you know, in our world is probably not all that realistic, but it's something to remember. So you can ask questions orally and write an opening question at the beginning of your lecture. Ask them about material you've already covered, and, you know, it doesn't even have to be about what we covered yesterday. Tell me something you learned this week, right? Instead of starting a class with a review, right? Because what do I think I want to begin class today with just reviewing the 3 key points that we talked about yesterday to set us up for today. That's what I would do, right? Because I want to make sure they're paying attention and they're connected. But I would be way better off to ask the class, where did we leave off? What did you learn? What did you not understand? Before I introduce the 3rd major theory in the course, there are 2 main theories we've already discussed, right? So this is about, so for example, one of the things I try to do if I'm at the board, the student teaching attending, I try to make, and let's say I'm doing AKI, I try to make them give me the algorithm rather than me just putting it on the board. Now, they give it to me all over the place, and I put it where it goes, you know, but at least I'm making them think about it. Okay, so this is about making them do the talking, more from them, less from us. Okay? Anybody see any downsides to this?
Takes more time.
It takes more time, right? I can teach less.
Also, one challenge is that there's a number of students that don't think they need to listen to what their classmates are doing. And so they feel like, I mean, obviously, they need
Oh,
to get over
absolutely.
that, but
Yeah.
that is a common thing that I watch in the classroom where they'll listen as long as I'm talking, but when I start kind of saying, okay, what do you remember about that and that and that,
Mhm.
half of them will attend their classmates, the other half are somewhere else, but the classmates to just not.
So from a faculty perspective, it feels challenging because I can teach less. But I would argue that if we look at this data, it doesn't really matter if I teach more, if no one remembers it, right? So that's an important piece. The other thing, this is this construct about how students like to learn and what's better for them are often diametrically opposed. So that piece about, you're absolutely right. I mean, I think you have to frame this thoughtfully. And so one of the things that, and it depends on the size of the class and what you're doing, but everybody writes down one thing they learned yesterday and then you cold call, right? Then everybody plays. Everybody plays. And they hate that. But it's really good for them. If you don't want to open with questions, you can close with questions. Closing questions are effective. They focus on the key concept that you want your learners to take away. So I think about this a little bit like for some of the faculty work we do. Like if I'm giving grand rounds, I should probably ask some questions, right? And if I'm really going to do it, that's part of what a lot of us do with our case-based questions, right? You start a discussion with a case and you ask people to what they would do, which is that prediction. I haven't told you the answer yet. Let me make you be thinking about what you would do. And then I'm going to teach you, and then I'm going to come back and make you retrieve it again and see if you can apply it. And this is that piece that you guys are talking about on concepts rather than facts, right? Those are harder questions to write, but more important. Make sure, the other thing, if you're going to do closing questions, you have to make sure you close the loop. You can't ask people questions and then not give them the answer for like 3 weeks, because you do run the risk of the memory tracks with wrong information being cemented. So you can either answer in class, you can post it online, begin the next class with the answer. If you're doing it online, the whole goal here is not to evaluate. It's a teaching strategy. So it's not about going and looking it up in the book. It's about seeing if you remember it, right? Online retrieval, you can do reading checks, questions scattered throughout the reading, frequent quizzing, spaced out due date. And again, the challenge of doing stuff online is that students may not spend the time trying to remember, they may just go look it up. I'm just going to say, think about how all of us do all of our online training for UPMC, right? Just the answer, please. I don't want to understand this. Okay, so predicting. The theory of predicting is that this is that thing about being asked to answer a question or to think about what's going to happen when you don't really know. Making predictions about material you wish to retrieve increases your ability to understand the material and predict it later. Predictive abilities prepare your mind for learning by driving you to seek the connections that will help you get the right answer. Searching for an answer you do not know opens up your brain, makes you try to figure out what you know. You're starting to make connections. You're thinking, what should I relate? And this activates your prior knowledge. So that when I then come in and give you the answer, all your prior scaffolding has been activated. If I'm just teaching you and you haven't activated your brain, I'm behind. You're behind because I have to activate my brain now before I think about this. So the prediction helps us recognize the gaps in our knowledge so you know what to listen to when somebody's teaching. And the wrong guesses are really helpful for exposing this fluency construct. Lots of students do really well on multiple choice tests because they can answer the question, they can recognize the right answer. But if you ask them a short answer to apply it, they fall apart. This, I've talked to many of you about my spectacularly awful experience with the first year class last year where I gave the Intro to Physical Exam students a multiple choice exam at the end of the course because I was cranky, they didn't know any knowledge, and I failed 2/3 of the class. So which was really special. I had to go talk to Jason, it was really, it was terrible. What was interesting is I actually asked some of the students, because then I had them retake the same exam, and 6 still failed it. So I pulled all those 6 and I said, what happened? And the one kid actually said to me, your exam was really hard. And I'm like, seriously, dude, it was all in the PowerPoint. I'm like, really? Tell me more. He goes, you actually had to know the answer. I couldn't figure it out from your answers. And I was like, okay, learned a lot there. So that's that exposing the fluency illusion. Our guys become really good test takers. So this is actually from an interesting, it was a quote in the book Small Teachings, but that predictive abilities reshape our mental networks by embedding unfamiliar concepts into questions that we at least partially comprehend. That's that piece. You activate the knowledge you have, and then when you're learning new stuff, you have the framework already set up. Even if the question is not entirely clear and its solution is unknown, a guess in itself will begin to link the questions to possible answers. This is why I put this quote in, because I like this last line. And these networks light up like Christmas lights when we hear the concepts again. So you've got, it's like a little line of lights where some of the bulbs are out, and I give you the answer, and all of a sudden my Christmas tree is lit up, right? But you have to get it active. You got to get the brain activated. And this actually, to me, was probably the thing. The rest of it I sort of intuitively got, but I didn't get this, that asking students questions that they didn't know the answer to was a really powerful learning augmentation. So the principles of prediction, and this is what we were talking about, prediction doesn't work with straight up knowledge, right? That's not helpful. So you need to stay conceptual. Predictions work by asking learners to draw whatever knowledge they might have to answer the question. And really, we do this a lot. This is the Socratic method. This is a lot of, like, when we stop, if in our clinical reasoning conferences that we're doing in medicine, one of the things that Sarah and Deb will do, who are running them at our different institutions, is we'll get the history, and then they'll stop, and they'll ask the faculty discussing to predict what would be important in the physical exam. Specifically, what are you going to go look for in the physical exam, right? That question is a prediction question. And it's a conceptual question. And it makes both the audience, which is who we hope, as well as our faculty who are doing these cases, stop and think about, where in their knowledge tree they're going. If you're going to ask students to predict, it's a little bit like the closing questions. You need fast feedback. You need to close the loop on every prediction. You don't want wrong predictions hanging around for very long because it can mess up your memory tracks. And then Tweed, this is where you were going, induce reflection. We do this a lot, and probably not as much as we should, but when something goes right or wrong with a patient, especially when it goes wrong, where did I blow it? Where was my anticipatory thinking wrong? Because frankly, when we get an unknown patient, it is a prediction. We try to anticipate what we think is the most likely diagnosis. We're predicting what's the most likely diagnosis. So this is what we do in medicine all the time. So predicting in practice, I'm gonna just move forward. Pre-testing. This is major test. You can give your exam at the beginning of the course and then give it at the end. Smaller pretest prior to each unit. Very brief pretest before each lecture. To do these kinds of things in your lectures. And again, it's the same. Much better for your learning. You obviously want to pick the questions that reflect the really important take-home messages, not stupid stuff, but the take-home messages. takes away your teaching time. But they walk away learning a lot more. This is what clicker questions are. The power of prediction to increase comprehension. The benefit of the clickers or the audience response system is that it offers learners anonymity, right? So everybody can play, but you don't have to feel intimidated, right? One of these things about, peppering people with questions is that you figure out your own gaps, but you expose your gaps to everybody else. And no one ever thinks anyone else has the same gaps they do. There's this prediction exposure feedback concept, which is really, again, what we do in clinical medicine, right? You predict what you think is going on, you get a bunch of tests and you figure it out, and then you go back and you essentially give yourself feedback about what you thought was happening. But we can do this with cases, right? In our workshops, in our PBLs, that kind of thing. Closing predictions. So this is, they talk about this, the examples they gave were like if you're reading Hamlet and you read Act 1, what do you think is going to happen in Act 2? Kind of thing, And Andrew's over here making a face like, seriously, what do I care? Shakespeare has to tell me, what do I care? But the idea is to think about, what I do sometimes is what do you think would happen, what would happen if, right? So change the conditions up a little bit, or when we're uncertain about a therapeutic endeavor. So I heard, trying to think of the example, somebody was like, so what happens if you give fluid and their urine output doesn't increase, right? Those are the what if questions. Those are prediction questions. But it really activates the learning. Again, prior to teaching, ask students to write down what they know, One of the things I'm thinking that maybe I need to start doing is asking students to write down their algorithm for jaundice or their algorithm for AKI, some of the things that I have algorithms for and that I teach. This would be interesting for them to actually try to put it into an algorithm form, because I think it's like a concept map. And then, when presenting cases, problems, or examples, stop before the conclusion and ask the student to predict what comes next. What physical do you expect to be abnormal based on the history? Interleaving is the concept that two interrelated activities promote higher levels of long-term retention. This is spacing out, and this is mixing up the practice of the skills. So this is the one piece of data I chose from today because I thought it was just mind-boggling. And again, the reminder that sort of learning data is always much. We're like in big epidemiologic studies, right? So this is researchers, 50 students into two groups to learn 20 French vocabulary words. Group 1 got to think, this is the mass practice. Sit here, learn the words for 30 minutes. Group 2, same activities separated into 3 10-minute study periods. So you had to stop and start your learning, which for a learner is frustrating and is hard. At the end of the study period, everybody got 16 out of 20. So, you were doing it over the week. At the end of the week, everybody gets it. 1 week later, the mass learning got 11 right. The ones that had the spaced learning got 15 right. That's a pretty big difference, right? Now you can argue about p-values and stuff like that, but it speaks to this power of spaced learning. So break it up, move it around, revisit it when we see it. The theory here is that the fourth cycle, this is a fourth cycle of forgetting and retrieving. You get to study this for a little bit, then you have to stop and go do something else, and then you come back. So I have to stop and remember what I knew when I stopped after the last session. The time that intervenes between spaced learning sessions also allows our minds to be better organized and solidify what is being learned. And the idea here is that every time you retrieve, it's like the deer in the woods, right? I talked about this, you're making a bigger path. Every time I open up my brain and have to pull this stuff up, I am reinforcing that circuit. And it's easier for me to embed new learning in long-term memory. There's a process called consolidation. Basically, I extend my track a little bit. My deer go a little farther into the woods. If I'm putting it in a construct of a well-established memory of learning, I get meaning, I connect it to prior knowledge, and the increased effort to retrieve the learning after a little forgetting re-triggers consolidation. That's hard, right? Because as a learner, I'm frustrated. I learned it, I forgot it, it's my porphyria, I have to learn it again. Sometimes it doesn't work. So block and interleave. Remember to add interleaving to the block courses that we have, and that's this piece about if I'm giving a cardiology test, I might want to talk about asthma in the middle of it, or something like that. Keep it small, keep it frequent, explain and support, because students get cranky. So you have to tell them what you're doing and why, because they get really cranky, because they overwhelmingly choose mass practice because it's easy, so you have to explain. I gave a variation of this lecture to the first-year medical students this year, mostly because I'm going to give them quizzes every week and intro to physical exam, so I was explaining why I was going to be doing that before the crankiness evolved. And again, how can you incorporate these ideas? Reserve a small part of your major exams and even your weekly quizzes for problems that require students to draw on older course content. One of the problems we have in the medical school is that we all teach one thing. Radiologists teach cardiology, pulmonary teach pulmonary. So you might have to actually reach back and go outside. Open or close each class session with small opportunities to retrieve knowledge. Many weekly review sessions, but make the students do the work. I used to really, the residents, our chiefs were doing lots of Jeopardy quizzes on Fridays, and it's like, this is not learning, this is just fun. That's wrong. Jeopardy's actually great because it reinforces, it makes you pull from what you learn. And then just ask them, at the end of every week when we're on wards or you have student teaching attending, name 2 things you learned this week. Name 2 things you learned. So my take-home message is, in order to learn, you must retrieve it. And the more you retrieve it, the better. Effort for retrieval makes for stronger learning and retention. Learning should be hard. I think we have moved to a place where we work so hard to make it easy for our students that we have undermined their learning. Testing is a form of retrieving. Testing is a learning strategy. The more we test, the better. Weekly quizzes, questions that start at the beginning of each lecture. This is even if they're not graded, but to make them answer them is really important. Predicting is retrieving. We can work with that. And then this repeated retrieval, which is interleaving and space practice, is particularly important. And actually, the longer you delay it, the more you forgot it, the harder it is to remember it, and the better you learn it. I have 3 references that I really think everybody who's actively involved in education should read. Small Teaching was one of the works that I used for this. The book Make It Stick, which is the science of learning. And then How Learning Works. Marie is one of the authors of this. So these are incredibly important books for me that have really totally changed how I think about teaching. And I think should really be required reading for our course directors. So with that, I'll close. We take any questions?
I have a question. And all of this, one thing I struggle with is interleaving. We interleave concepts that really are not because the postulate is that if you interleave math and English, you're going to be better at both. That would make sense that the mythical, we learn about the mythical medial cranial fossa, one 15-minute block, and then Frank Starling throws the next 15-minute block, and somehow both of those are going to be better. And I definitely believe that it works within the same subject matter, a different portion of the subject matter. You take this portion of cardiology, this portion of cardiology, bring it back. Was there data on it specifically on really disparate subjects? Because if so, why did we ever go to block systems 15 years ago? There must have been some data that block systems were better because high schools do this, college.
Yeah, I don't, it was clearly in vogue 15, 20 years ago. And Marie, do you know why we went to blocks? I'm not sure this data was appreciated at that time. And I would answer your question in 2 ways. The sort of teaching math and English that aren't related, and then stopping your math and then learning your English and then going back to math. The benefit of that is just in the retrieval. It's just in the retrieval. It's not in making conceptual connections. But again, that's long-term durability of knowledge. The learning of space learning would be the same thing in repeated over time. This interleaving really is different concepts. That's a little different than saying I'm going to talk about like the physiology of the heart and the pharmacology of the meds that play off that physiology. That to me is a form of interleaving, but that's building conceptual framework. So they're both important, and it is not intuitively obvious that teaching a little bit of math and a little bit of English and then coming back to the math is a better strategy than math on Monday and English on Tuesday. And that was eye-opening for me. Thank you, everybody. See you next week.